Hello and welcome. My name is Robin Otten, and we're here to discuss a little bit about a subject that I know you've been hearing a lot about recently, and that is the health insurance exchange. There's a lot of confusion, and we have some people here today who can help you get through that confusion and answer your questions for you. So we hope that you'll learn a lot today and that you'll enjoy this information. First of all, I'd like to introduce my guests. I have with me today Deborah Hummer, who is the New Mexico Health Insurance Exchange Chief Communications Officer, and also Robin Hunn, who is a consultant to the exchange. So I'd like to start off with Deborah and ask the first question of her. What is the New Mexico Health Insurance Exchange, and how was it started in New Mexico?
Well, the New Mexico Health Insurance Exchange, or NIMHIX, maybe we'll call it the exchange for the rest of the conversation.
Great idea.
Well, basically, it's a nonprofit organization that was started by the New Mexico legislature in March of this year, and it was created in order to implement the provisions of the Affordable Health Care Act. So individuals and small businesses now can shop on the exchange for affordable health care coverage.
Mm-hmm. So Deborah, how many uninsured people do we have here in New Mexico?
Well, there are about over 430,000 uninsured New Mexicans, and we estimate that 200,000 will be eligible for the exchange, and then about 175,000 will be eligible for the Medicaid expansion.
I've heard that there are subsidies that are available for some people, and how does the exchange premium subsidy system work?
Well, basically, if you're eligible for a subsidy, it's based on a couple different factors: your age, your family size, geographic area, as well as tobacco use. And there are limits to the premium subsidies, but most individuals will be eligible if they meet some of these characteristics. But we really feel that the tax credits, well, you can go and actually go online to our site and look and see what kind of tax credits you can get based on these requirements. Robin, do you have anything to add on that?
And maybe we could kind of talk a little bit about, who the exchange is really focused for. Obviously, the uninsured population, people who don't get coverage through their jobs, or people like myself who buy insurance on the individual market, are looking for a better deal and more choices.
Great. Do you have any examples of how these subsidies might work?
Yes, we can give you like some specifics. And as Deborah said, there's on our website, which is www.bewellnm.com, you can go in and actually calculate for your own particular family size, your location and your income, and figure out exactly what your premium subsidy would be. In kind of broad terms, if you're a single person and you have income below about $16,000 a year, you're going to qualify for a Medicaid expansion coverage in New Mexico, and that coverage is, for the most part, free. So that's a brand new thing in New Mexico that people are just now learning about. If you have higher incomes, up to about $94,000 for a family of four, you'll qualify for a subsidy on the exchange. So you can have pretty significant incomes and qualify for those subsidies.
Yeah, that sounds pretty generous. Yeah. When can people enroll, and when does the coverage start?
So the open enrollment is now, started October 1, and that's all across the country, and here in New Mexico as well. It's an open enrollment period, so people have until March 31st of next year to sign up as an individual. We have a small business program too, and that's open year-round for businesses to sign up.
See. Deborah, what do these health plans cover, and how many plans are there?
Well, the exchange requires that plans offer a standard range of health benefits. Some of these are doctor's visits, prescription drugs, outpatient services, emergency services, hospitalization, maternity, newborn care, mental health, substance abuse coverage, behavioral health treatment, prescription drugs, rehabilitation, laboratory services, preventative services, chronic disease management, pediatric services, and oral and vision care for children. So obviously a lot of the basic things that you want to be covered for.
Almost everything you can think of.
Exactly. So we really want to make sure that these plans cover the things that people will need in the future. And then we have a lot of different plans, and the costs vary for those plans. These are called qualifying health plans because they cover these essential health benefits. And there's 4 categories that people have probably heard of. There's the bronze, the silver, the gold, and the platinum. The more precious metals like platinum and gold are going to be more expensive, but they will have lower out-of-pocket costs. And so it's vice versa with the bronze and silver plans. And we offer a couple different plans for the individual market, and that's Loveless, Molina, New Mexico Health Connections, and Presbyterian and Blue Cross Blue Shield. And for the small business exchange, we have Loveless, Blue Cross Blue Shield, Presbyterian, and New Mexico Health Connections.
So what is the most important thing for people to think about when they're choosing a health plan?
Well, pretty much what you always want to think about. If you want to keep your doctor, you should really look at a plan that has your doctor in their network. So that's very important. If you're on certain prescription drugs, you're going to want to make sure that the plan covers that formulary as well. You might want to look at whether or not you want lower out-of-pocket costs. But if you're healthy, you might want to get more of a bronze or silver plan. If you have more health issues, then you're going to look at more, maybe the platinum or silver plan.
I see. How does this affect seniors like me who are on Medicare?
It doesn't have an impact on seniors with Medicare. You get to keep your plan, and in fact, if you are eligible for any government program, you wouldn't be on the exchange.
I see. Robin, how do people in Albuquerque sign up?
There's a whole lot of different ways. They can go to our website, and that will take them directly to the federal website to sign on directly themselves. They can also call our call center and find more information out. They can also talk to a healthcare guide. We have about 500 people that we're getting trained across the state to actually help people sign up with one-on-one assistance. So in Albuquerque, all the first choice clinics are in the process of becoming healthcare guides, or already are. UNM, all their hospital and clinic facilities have healthcare guides. Other nonprofits like YDI, quite a variety of nonprofits. I think there's over 40 agencies in the Albuquerque area that you can sign up with.
If I want to sign up, what kind of information do I have to have accessible to me to be successful in signing up?
It's pretty easy. You have to have your income information, your tax return, your last tax return. If you don't have a last tax return, recent wage information. You need your social security numbers for everybody in your family. You need information if you have any kind of health coverage through an employer for any member of your household. And that's pretty much about it you have to sign up for coverage.
Great, that sounds pretty simple.
Yeah.
Yeah. Why should people do this, Deborah, and why is it important?
Well, first of all, it's the law that people are covered.
That's a good reason.
That's the simple reason. But really, you're going to face a penalty starting next year if you don't have health coverage, and that's 1% of your gross income, or $95, and it's $47.50 per child as well. And that will go up every year as well. But I think, besides the point that it's the law, it's good to have health coverage. I mean, everybody wants to feel secure. They want their families to feel secure. Just a broken arm, could cost you thousands of dollars and cripple you financially. So it's very important to have health care coverage. And you never know when you're going to get sick or have an accident. So we think that this program's great because it offers so many New Mexicans who don't have health insurance coverage so that they can feel secure.
What about health insurance for small businesses?
Well, New Mexico is fortunate that we started our own SHOP program for small businesses, and that's any employer with 50 or fewer employees. New Mexico is running its own technology platform for that this year. I know there's been lots of talk about the federal platform, but we haven't had really any glitches or anything, so we're pretty proud of getting up our SHOP in less than 6 months. And it really allows businesses to shop for affordable healthcare coverage for their employees, and we know that a lot of employers want to do that. It's great for business. You get to keep great employees and make sure that they're there on the job when you need them. And there's a couple great benefits really for the small business owners right now that they should know about. We're in a golden enrollment period, and that means we're waiving the participation requirement, and that means you don't have to have a minimum of 50% of your employees involved in your or covered in your plan. And so that's a great benefit, and that only goes to the end of November. So now is a really great time to sign up. Another really important thing for small business owners to know is that you're only going to be able to get tax credits if you buy health insurance through the SHOP exchange. So that's a benefit for everyone. And then there is rolling monthly enrollment for that. So if they enroll this month, which is November, employee coverage would start February 1st, and so on.
Deborah, in case anybody has any questions that we haven't been able to answer, could you give us how we can get in touch with you?
Absolutely. As Robin said, Be Well New Mexico, or it's bewellnm.com. That's going to be a great resource for you. You can find out where our healthcare guides are if you need help in enrolling. You can see all our brokers as well. We also have a call center, and that is at 1-855-99-NMHIX. And that's 24/7. And our call center representatives are great, and they can really answer a lot of questions for you, both about the individual and SHOP programs.
Great. Well, thank you so much to our guests this afternoon, Robin Hunn and Deborah Hammer. We really appreciate you being here and being so information rich. And we hope that we have helped you so that you can get onto the exchange, get the health insurance that you need in an affordable way. So thank you again for joining us.